Are you suffering from knee arthritis? Have you ever woken up in the middle of the night with a stabbing pain in your knee or big toe? Does the slightest touch make you wince in pain? If you are living with gout every day, don't miss this video, because what you are about to learn could be the real turning point in helping you get rid of that nagging obsession. Many people believe that just abstaining from red meat and alcohol is enough. But the truth is that uric acid continues to accumulate in the blood, silently causing inflammation, swelling in the knee, toe, wrist, and leg joints, and destroying the joints over time, even when you abstain from everything. The good news is, you don't have to look far for a miracle drug, because right in your kitchen, a cheap, colorless, odorless ingredient is a powerful ally in the fight against gout and arthritis: baking soda. You may not know, just a small spoon of baking soda, dissolved in water, can help rebalance the pH in the body, neutralize uric acid, reduce inflammation, and thereby significantly relieve joint pain. Importantly, this is not an unfounded word-of-mouth tip. This is a measure that has been applied by many people in reality, bringing positive results when combined with a healthy diet. In this video, I will share with you how to use baking soda properly, in the right dosage, important notes to avoid side effects, and why baking soda is not only a baking agent, but can also become a natural anti-gout medicine if used correctly. Let's explore with me right away, and maybe you will find the key to walking more lightly, no longer haunted by gout pain every day. To effectively deal with gout, we first need to understand who the enemy we are facing is. Gout is a painful form of arthritis that occurs when uric acid accumulates in the blood and forms sharp crystals in the joints, especially in the toes, knees and wrists, elbows, causing inflammation, swelling, redness, and severe pain in the knee joint, in the big toe, but can also occur in the wrists. The cause of gout is high uric acid levels in the blood. It can come from eating too much red meat, seafood, animal organs, drinking a lot of alcohol, especially beer, containing purines, overweight, obesity, lack of exercise, genetics. If a relative has gout, your risk is also higher. Underlying diseases: kidney failure, high blood pressure, diabetes, taking diuretics. To prevent the pain from recurring, we have to go deep into the root. How to reduce the amount of uric acid accumulated in the body. And this is when a familiar ingredient in the kitchen can enter the battle. Baking soda or sodium bicarbonate can play a useful role. Baking soda can help increase the pH of both blood and urine, making uric acid more soluble and less likely to form painful crystals. Not only stopping at theory, many scientific studies have also clearly demonstrated the potential benefits of baking soda in supporting the treatment of gout. A study published in the British Hospital Medical Journal in 2024 showed gout patients using baking soda in combination with standard treatment drugs had a significant reduction in serum uric acid levels and less crystal deposition in the joints than the group using only drugs. For those looking for natural strategies to relieve the pain and discomfort of gout, this everyday kitchen remedy can provide meaningful relief when used in conjunction with medical guidance. In addition to helping with gout, baking soda also plays an important role in helping the body maintain a balanced pH level, which is fundamental to overall health. A healthy body needs to maintain a slightly alkaline pH, around 7.35 to 7.45. If the pH drops too low, acidosis, it can cause fatigue, muscle weakness, and disrupt cellular metabolism. Baking soda helps neutralize excess acid, supporting the natural buffering system, especially after a high-protein, acidic meal or after strenuous exercise. Although baking soda has many potential benefits, misuse can be harmful. Recommended dosage: 1/4 to 1/2 teaspoon. Baking soda mixed with a glass of water, about 200 milliliters, taken 1 to 2 times a day. Do not use for more than 7 consecutive days unless directed by a doctor. Never use in children, pregnant women, or people with underlying medical conditions without medical advice. Not stopping at joints, baking soda also has many other amazing uses for daily health that you may not know about. First, let's explore one of the most popular uses: teeth whitening and oral care. Baking soda has the effect of whitening teeth and supporting effective oral hygiene thanks to its gentle but safe abrasive ability, helping to clean plaque, remove yellow stains caused by coffee, tea, cigarettes, or food on the tooth surface. Not only does it clean, baking soda also has mild antibacterial properties, helping to kill bacteria that cause bad breath, thereby making breath fresher and more pleasant. Thanks to these characteristics, baking soda has become a popular ingredient in many whitening toothpastes. In addition, many people also choose to dilute baking soda with water to use as a natural mouthwash, helping to clean the oral cavity and maintain fresh breath every day. However, to ensure safety for tooth enamel, do not overuse or rub too hard, and should only use 2 to 3 times a week. From the mouth, let's go deeper, into the digestive system, where baking soda can help you feel better after a meal. Baking soda is naturally alkaline, so it's often used as a temporary solution to neutralize stomach acid. When stomach acid is overproduced, often due to overeating, eating fatty foods, or drinking too much alcohol, people can experience uncomfortable symptoms like heartburn, bloating, nausea, or a burning sensation behind the breastbone. In these situations, baking soda acts as a neutralizer, reacting with the hydrochloric acid in the stomach to form salt, water, and CO2 gas, providing quick relief, reducing heartburn, and improving digestion. However, baking soda isn't a long-term solution to digestive problems. Using it too often can disrupt the pH of your stomach, reduce your natural digestive ability, and even cause excessive alkalinity, electrolyte imbalance, and symptoms such as nausea, muscle weakness, or seizures. In addition, baking soda contains sodium, so it is not suitable for people with high blood pressure, heart disease, or kidney failure. Baking soda can also be effective on your skin, especially when you have insect bites or sunburn. Baking soda is not only a familiar ingredient in the kitchen, but also an effective natural remedy for soothing mild skin problems, especially when you have insect bites or sunburn. When you are bitten, the surrounding skin is often slightly inflamed and causes severe itching. Mixing baking soda with a little water to form a paste and applying it directly to the affected skin can relieve the discomfort almost immediately. Baking soda is also very useful when you have sunburn or mild irritation due to too much sun exposure or dry, flaky skin. Adding a few tablespoons of baking soda to a warm bath and soaking for a few minutes can help soothe the entire sunburned skin, reducing the burning and discomfort. In addition, if you do not have the conditions to take a full body bath, you can also use a soft towel soaked in diluted baking soda solution to apply to the affected skin area. Even in cases where you feel a burning sensation when urinating, baking soda can temporarily help you feel more comfortable. Baking soda is used as a temporary support measure to relieve the uncomfortable symptoms of mild urinary tract infections. When suffering from mild infections in the urethra or bladder, usually caused by bacteria, the patient often feels a burning sensation when urinating, frequent urination, and a burning sensation when going to the toilet. You can mix 1/2 teaspoon of baking soda with a glass of warm water, about 200 milliliters, and drink it when you feel uncomfortable. Baking soda does not have antibacterial effects, so it cannot replace antibiotics in the treatment of urinary tract infections. If the condition lasts more than 48 hours, is accompanied by fever, lower abdominal pain, cloudy or bloody urine, The patient should see a doctor immediately for an accurate diagnosis and proper treatment. However, despite its many benefits, we should not mistake it for a miracle cure. It is not a miracle, but sometimes just a small choice, like a spoonful of baking soda at the right time, can help you escape sleepless nights due to joint pain. However, it is important to understand that overuse or prolonged use without medical supervision can cause many potential risks, such as electrolyte disturbances, high blood pressure, water retention, or kidney damage, especially in people with underlying medical conditions. Therefore, baking soda should not be considered an alternative treatment. It only plays a limited, short-term complementary role to improve quality of life or alleviate symptoms in certain situations. If you're looking for a way to relieve gout pain, recover from a workout, or regulate your pH in a healthy way, baking soda can absolutely be a worthy option to consider. But only if you use it wisely, with knowledge, and always listen to your body.